Okay, we're here at Capital Vein and Laser Center. I'm Dr. McNeill, and this is Marcia. And Marcia's had a remarkable journey with her varicose veins. Not only the correction that we've just been in the midst of doing, but also what Marcia's experienced as a nurse over many, many years with her legs. Thanks for spending a minute with us.
Sure, well thank you for everything.
So tell me about your veins. We talked about that when you first came to see me.
Yes, I've had this for at least 20 years now, and like I said, I'm a nurse full-time, and I have really suffered. I have had leg ulcers. It was after I had my first child. I have 4 children, and I've had such extensive problems with my legs. It started out really after I had my first child, to be honest, and I've had such extensive swelling, leg ulcers, and back then, I still was so reluctant to ever have surgery or really seek any further intervention. Very fearful of going through that.
And that's very common. The treatments that were available in the past that our mothers would have told us. So anyway, in the past, the types of treatments that were available, which was basically the stripping operation where the veins were removed from the leg, literally ripping them out, people were persuaded not to do that, and that was probably your situation.
It was, and again, I was very, very fearful of going through something of that undertaking, but I had such poor circulation, my feet were gray, my toes were literally cold, in addition to just the swelling and discoloration, and finally I decided I had to do something when I had leg ulcers. I had bleeding that shot out, almost like arterial in nature.
Yeah. It can, one of the things about venous disease is that it's a progressive problem, so that uncorrected venous disease, which you would be a very good example of, just continues to progress until it affects the skin, and then it becomes, in many cases, a permanent problem. Fortunately for you, you came in to be evaluated.
Right. And just to show a comparison of what I've gone through with this procedures, the stripping put me out of commission for about 2 weeks, and the level of pain post-operatively was unbelievable. I was on narcotics for about 2 weeks.
Wow, and how many years ago was that?
It was after I had my 4th child, and he's now 14 years old.
Wow, yeah.
So, and I'm a very active person, and it was 2 weeks of narcotics.
Yeah.
The pain was unbelievable.
So you came to us and we did the ultrasound and worked up your leg veins.
Yes.
And you've had venous closure. What can you say about that experience?
I've had 3 venous closures, and again, I work full-time and I haven't missed 1 day of work. There's been no problems. I followed the directions that you stayed, where you didn't exercise, but after 3 days I was able to go back to the gym and go on the treadmill.
Right.
And I followed the directions very carefully that they all spelled out as far as travel and whatnot. But I drove myself to the office, had the procedure, and drove myself right back home.
That's fabulous. And what would you say about maybe the discomfort or the experience of actually having the procedures?
Well, being a nurse, I'm unfortunately timid. So not a good patient in that regard, but everyone was very kind, and it really was very tolerable.
Oh, very good.
And afterwards, I think I have had 7 procedures, maybe 1 dose of Motrin.
That's awesome.
And it wasn't actually from the procedures, just from the leg wrap.
Right, right. Now you've already seen some changes in the legs.
Amazingly so. The swelling, like I was mentioning before, first of all, the discoloration to the skin. The purple, I didn't even know my skin had normal skin color. I had freckles that I never even knew existed to the skin, and then the contour of the ankles I never had before in 20 years.
What were you telling me earlier today about going to this wedding?
We'd gone to a wedding over the weekend, and my shoes, I was having a hard time walking. I thought there was something wrong with the shoes, and I was actually tripping in them. They were flopping on my feet.
Right.
Just from the swelling, and amazingly so.
It's hard to believe, but when I met Marcia, there's a total disconnect between meeting Marcia, she's so lovely, and then when you looked at her legs and what they've gone through, and now to see the legs clearing up is really gratifying. And we're just at the end of Marcia's treatment, which has now included vein removal, that's the phlebectomy, so that her legs, the bulging varicose veins that were there before are basically gone. And hopefully in the near future we're going to be able to take care of the spider veins.
Right.
And then I guess we're just going to have to get a consent from your husband to do some shopping.
That sounds good. That sounds really good. I've had family members come up to me and they can't believe what my legs look like. They really can't.
Yeah.
It's a thrill to me.
And the other part of this is the health of your legs.
Exactly.
And having them feel better and to get rid of that swelling.
Mm-hmm.
These are all enormous benefits. And with today's vein care, one of the things that we are doing is we're changing the course of somebody's legs by taking them off of this progression to difficult problems and heading in a direction that's going to be much more healthy, enable the activity that we want, and also, which is no small consequence, also just feel better about the appearance of the legs.
Yes, in the summer, I was very reluctant to ever, go out if you were in a skirt or a dress without hose. And this is in the 90-degree weather.
Right.
And I know when I would be at work, I would see them visually staring at my feet with a grimace on their face. They were black, and by the end of the day, it looked like someone had taken a big pile of dark dirt and just thrown them onto my feet.
Yeah.
They would just turn blacker and blacker and blacker. It was amazing.
Yeah. Well, I can say that your legs look so much better now, and then after
Me
we
too.
finish the sclerotherapy, it's going to be even more amazing. And
Yeah.
I just want to thank you for sharing this, because there's a lot of patients that are really trying to discern whether this is for them.
Right.
Moving forward with treatments, particularly a lot of people rely on stories of old, where they're thinking that it's a vein stripping, when in fact these new procedures, the venous closure procedure and vein removal, are just so simple. And that's all for now.
Exactly. Thank you very much for everything.
Absolutely. Thanks. Good.